Hello, everyone. Our project is on the effect of various demographics on infant mortality rates. You might ask, what exactly are infant mortality rates? The infant mortality rate can be defined as the number of infant deaths before the age of 1 per 1,000 live births. It is one of the most important and powerful measures of a nation's life expectancy and is associated with the economic and social conditions that shape the health of mothers and newborns. This paper will explore differences in infant mortality rates amongst 4 different demographic characteristics: region, race, education, and income. Exploration of infant mortality rates among these different aspects would allow us to explore what kinds of familial units are more likely to lose their infant children. This brings us to our research question. What demographics contribute to America having a higher than average mortality rate? It is important to note that it is most likely not one factor causing this problem, but several that contribute to this nation's issue. We are going to narrow in on these specific 4: region, race, education, and income.
To start off, we're going to look at the United States infant mortality rate as a whole. In 2019, the infant mortality rate for the U.S. was 5.9%. This is in comparison to the 3.8% infant mortality rate for the OECD. This is a conglomerate of other countries that are close to the U.S. However, there has been a steep decline over the past 70 years within the United States for its infant mortality rate. Even though we are still on the high end of the spectrum, we are at a decline. In the graph below, you can see where there is a slow and steady decline happening between these 2 factors. What are some factors that could be contributing to the U.S. infant mortality rate, you might ask? One of the factors that could be contributing is region. The U.S. is broken into 4 different regions on the census: the West, the South, the Northeast, and the Midwest. There's a higher average infant mortality rate in the South at 6.7%. There's a lowest average infant mortality rate in the Northeast at 4.7%. Other percentages can be found in our paper. However, you can see on this graph that is made down here in the corner that they are listed below in their respective rates. The South is at the top and the Northeast is at the bottom, with the West and the Midwest in the middle. Regional impact. You would think that bigger regions have more states, and that leads to having a higher infant mortality rate. While this is something that does come up in research when discussing infant mortality rates, it is not the main cause as seen by many researchers across the field. It does lead to having bigger populations in certain areas at times and having more babies to account for in these numbers. However, there are cultural components based on inhabitation that are conducive to this infant mortality rate disparage. These include healthcare dependency, vaccination practices, and other things like this. So that can be the difference between you deciding that you have to go to a doctor if you're feeling sick and ill, or if your baby is feeling sick and ill, versus if you are a holistic person who believes in using oils and herbs to heal your sicknesses. But it also leans into the intertwinement that region has on race, education, and income, just to name a few, but other demographic nomenclatures as well.
Race. As you can see in the chart to the right, non-Hispanic Blacks have the highest infant mortality rate, while non-Hispanic whites and Asians have the lowest rates. This difference between the 2 extremes is shockingly large. By increasing our awareness, then we can figure out what other factors play a role into this. Race by state. Non-Hispanic Blacks have the highest infant mortality rate across each state in the U.S. According to the interactive chart here, the highest mortality rates for non-Hispanic whites are in the more rural areas where there's less access to resources and things, whereas non-Hispanic whites have the lowest rates in the Northeast urban areas where medicine is more advanced in comparison to the rest of the country. This highlights the fact that there are other factors besides race that play a significant role in these infant mortality rates.
I will be discussing the factor of education in terms of the infant mortality rate. Infants born to more educated mothers have lower mortality rates, which has been shown in recent studies. The rate of babies born to white, college-educated U.S. couples, which is 5.4 per 1,000 live births from 1983 to 1985. Mothers with less than a high school education in 2016 experienced 2.4, 1.9, and 3.7 times higher risk of infant, neonatal, and post-neonatal mortality than those with a college degree. In 2016, relative risk, also known as RRs, of mortality associated with maternal education indicated 135%, 119%, and 75% higher mortality risk for infants born to mothers with greater than 12, and 13 to 15 years of education than infants born to mothers with a college degree. U.S. infant mortality rates due to education in the year of 2016 was at a rate of 5.9%. Educational inequalities in infant mortality have also increased in relative terms during the past 3 decades. And also, less educated women may not seek the resources needed to maintain a healthy pregnancy or seek medical advice, which in turn leads to them losing their child.
While race, education level, and region all showcase disparities in infant mortality rates in America, income is another prominent factor. A person's income specifically refers to the money they receive through work and investments, especially on a regular basis. While income has a significant effect on other potentially fatal phenomena in American society, such as heart disease and diabetes, it is important to understand the way in which it affects infant mortality rates, as infant mortality concerns beings that haven't had at most a year on Earth. Nothing these infants are willingly doing seals their fate, so what are the other factors in play? Newsflash. According to the 1988 National Maternal and Infant Health Survey, for women with household incomes below the poverty level, the infant mortality rate was 60% higher than their counterparts. Furthermore, it was reported that the post-neonatal mortality rate was twice as high as those for women living above poverty. Over in Brockton, Massachusetts, there were reports on infant deaths occurring at a rate of 86.5 per 1,000 births generally. When there was more than one person in a living room, that number rose to 110.2, and where there were more than 2 persons to a room, only 32 out of 1,210 babies were born. We can see from these facts that poverty, and more specifically overcrowding in homes, has an effect on infant mortality. Let's take a deeper look into how one's income can affect their chance of birthing healthy babies. This table showcases infant mortality rates by fathers' earnings in 8 U.S. cities, including Johnstown, Manchester, and Brockton, and a few others. The table showcases from left to right the total births in each city, the number of babies that fell victim to infant mortality that year, and finally the percent of total babies born that year is showcased. From viewing the data provided in the table, it is apparent that for fathers' earnings that were under $550, there were more infant deaths that year, while the other group of fathers earning $1,250 and over experienced less rates of infant mortality overall. It is important to note that this particular study was conducted in 1919, which is why there is an emphasis on the father's earnings, because men were the primary breadwinners / sole income providers of most families during that time. With all of this data, you may be left wondering, what exactly does this imply? All in all, we can conclude that there is an obvious inverse association between infant mortality and income economic status. Essentially, the lower one's income, the greater chance they have of being subject to infant mortality because of various factors, including the inability to afford health care, safe living spaces, access to necessary resources for the baby, social capital, etc. Some of these factors would take unforeseeable measures to combat immediately, but there is one given fact that we need better health care available to people who are of lower income status if we are ever going to be able to decrease the infant mortality rate in the United States. Thank you.